Hello, thank you for joining the latest one-on-one episode, a video series from Modern Healthcare Custom Media featuring insights from leaders across the industry. I'm Maria Castellucci, a custom content strategist here at Modern Healthcare, and on today's episode, it's my pleasure to be joined by Audrey Coppola, Director of Consulting Services at Surgical Directions. In her role, Audrey supports hospitals in the collection and analysis of data. Audrey has broad healthcare experience. Prior to joining Surgical Directions, Audrey worked as an employee, resident, and student consultant with Rush University Medical Center, United Hospital in Minneapolis, as well as other community and academic centers. Today, Audrey and I will be talking about the role of interim staffing in healthcare. Before we dive in, I'd like to tell you a little bit about the sponsor of this episode, Surgical Directions. Surgical Directions is a specialty healthcare consulting firm composed of professionals with deep experience working side by side with clients to achieve the absolute greatest impact and sustainable performance possible. From assessment to implementation to interim or permanent placements within your leadership team, Surgical Directions is more than a consulting firm. They're a collaborative partner dedicated to your success. Audrey, thank you so much for being here today. I'm really excited for our conversation.
Thanks, Maria. I'm really looking forward to it as well.
Okay, so today we're going to be talking about the crisis level staffing challenges that hospitals and health systems are facing right now. Can you explain to us what interim staffing is and how it's being used by organizations as a tactic to address these staffing issues?
Yeah, absolutely. So interim staffing is really just a way to bring on an extra pair of hands, someone that's experienced, a subject matter expert that can come in a short or midterm period of time. We're really seeing organizations bring these people on for the most part to really keep services moving, to fill those service gaps, both from a clinical perspective or operationally, just to keep the day moving and to keep seeing patients and take care of them day to day.
Can you dive into what are some of the additional advantages or strategies for hiring interim resources?
Yeah, absolutely. I think first off, when you bring in an interim, you're going to really help with the staff relief. So a lot of the times when you have that gap from someone that has left or perhaps moved on and you bring in an interim, what's happened is from that gap, really, you've taken on that burden and you've put it on maybe your hardest workers, your high level performers, and then you're causing them to potentially have burnout. So hopefully by bringing in this interim, they're able to take some of that off, hopefully getting some better retention for those staff members and maybe even reducing some overtime on them. I'll also say that if you've done your homework and you've gotten a really good interim, then they've been around the block a bit and they're able to come in and give you a fresh perspective on what's happening. They've been a couple other places. They've seen what's worked well and what hasn't worked well. And so they can see and bring in maybe some best practices that are happening in some other places. So I think that's really a good advantage. They're also used to rolling up their sleeves and getting to work. They know that they got maybe 6 months to come in and create change. And that's what they like doing. They're an interim because they want to make a change. They want to go to different communities and make an impact. And so you've got someone that wants to dig in, get to know people and create an impact. And lastly, I'd say, they're going to serve as your smooth transition. If you have a gap, if someone's left, maybe it's left a weird feeling going on. And so you're bringing in someone new, not only to kind of smooth out, maybe what's happened previously, but also to give you some time to figure out who that permanent person might be or what your permanent strategy should be, and not have to rush into a permanent decision.
Okay, awesome. So you've done a great job of explaining kind of the advantages of interim staffing. Can you talk about what the challenges that come with interim hires and what challenges the hospital might face specifically if they deploy interim staffing?
Certainly. Yeah, definitely want to talk about some of the things that people should have their eyes open to, be proactive about, and what you can be prepared for when you're thinking about doing an interim. We think of interims as being really different from full-time employees, but I think there are some things that we need to be considerate of where we should treat them kind of similarly to a full-time hire. And that's with, I would say, their onboarding how you onboard them. So even though they're only there for a short time, they're still an external stakeholder that's new to your organization. And I think it's going to be really important that you spend a good amount of time getting them up to speed on what are your policies and procedures, what is your culture like, and really making sure that they understand what the expectations are in their role, what are their priorities, what are their deadlines. I think it's just as crucial to make sure that they have a really strong onboarding experience. And some may see this as a challenge because you can't just really set it and forget it with them. It's really important that you make sure that they have a good onboarding so that they can be successful in their short time period. I'd also say that people really worry that bringing in an external person, there's going to be maybe some trouble with team integration. How is this person going to impact the team? Are people going to be concerned about, this outsider coming in, and what does it mean for the organization? So I think it's going to be important to really be proactive about how you manage this transition. And there's some ways that you can do this, really making sure that there is introductions set forth when this new hire comes on, really making sure even before that you bring them on and you're doing interviews, is this person going to be a cultural fit for your organization? And finally, I would say, making sure that this person is not, or recognizing that this person is not a long-term investment for you. So we've talked about this. This is a short-term person for you. You have to do the parallel processing while this person's in place. I said it before, it's not a set it and forget it. You got to be also trying to find your long-term solution. And so that when this person leaves or the time period is up at 6 months, you haven't done nothing. And then you're like, oh, shoot, I got to get another interim, or I got to, spend the time to extend this person. You got to make sure that when this person leaves, you have a plan of action for them to pass off to your long-term solution.
Okay, really great information there. I want to dig a little deeper into what an organization should be looking for when they are trying to find and hire an interim employee. So, what should they be doing to find the right interim employee, especially in a time crunch?
This is a really good question. And I think it's about half of organizations today are actively looking for interim staffing. There's staffing shortages. We all know it. And I think one important thing is to just set some expectations that you're not going to necessarily find someone tomorrow, but there are things you can do to expedite it. It's just important to know that you don't want to just, call someone next door and just do one interview. You want to get a big sourcing pool of candidates. You want to assess their skills. You want to assess that cultural fit, do a background check, and make sure you find a good person and not just bring anyone in that could cause more of a problem than a solution.
Right.
But if you do have dedicated resources to get you a good diversified pool, then you're going to set yourself up for success. I would just say that look within your organization internally, see if you have the dedicated resources, HR, team, recruiters that can go out and source your candidates for you, kind of do the job postings, look across, LinkedIn, all those boards, and even go to candidates that are already, interims at other organizations and network with them and see, what's your next job. Really reach out. If you don't have those dedicated resources that can do that, then go out, do your research, find a reputable firm that can go ahead and help you do that work for you. I would just make sure that you're finding an organization that has been working in our industry, that has worked for someone of your size and scope, that can help dig in and really be your partner along the journey.
Okay, so let's talk about how interim staff can be integrated into an organization and care team that is well received by employees and staff. How can they do that?
Yes, and we touched a little bit on this earlier, but I do think that it's going to be really important that you are very open and transparent with your staff about the interim coming on. And so having a staff discussion before the interim comes on to the organization is going to be really helpful to kind of let the staff know and be clear and honest about what the interim role is going to be and what the expectations are for that interim for the duration of their time on site. I also think that kind of in line with communication is really setting up introductions for the interim with the staff members and the team members that they'll be working with is going to be really helpful, rather than just letting it kind of be ad hoc. Really ingraining and creating forums for this is going to allow for them to get to know each other and allow for that collaborative work effort to take place as the interim comes on site. In addition, I would recommend that perhaps you set up a sponsor type relationship for the interim with someone on site for them to just, have regular check-ins with. This doesn't have to be anything really intense. Could just be, regular 15-minute check-ins, so that they really have someone to go to if they have questions about the culture or even just, operationally. And so that any kind of small problems could really be nipped in the bud right away, and really just allow for, smooth success for that interim while they're on site. We talked a bit about kind of onboarding the interim, and I do think that really setting them up for success this way is going to be important. At Surgical Directions, we really do make sure that we're working with the interim, setting up their housing. We're also collaborating with the organization, with their HR team, making sure that the interim has all the policies that they need, that they're going through any training that's required to be working at the facility. But this also includes any technology, any tools that they'll be using day to day, all of those things, having their computer password, if that also is applicable, but really just making sure that they are ready to go, ready to ramp up, because by week 2 or 3, you really want your interim to be, really smooth sailing into what they should be doing. If they only have, 3 or 6 months to really make an impact and get through some of the key items that you want them to accomplish while they're with you. And lastly, I would just say, really, making your interim feel like they're part of the team, like they're part of just a normal employee, making sure that there's, water cooler conversations happening, regular socialization events, that again is allowing for them to become a part of the team and allow for those really important collaborative moments to happen, both, outside of the day-to-day, but also really in the working environment.
Great. So Audrey, you've already gone through some really great best practices for our audience, but can you talk about what other major considerations or best practices a hospital should implement as they look to implement interim staffing?
Yeah, absolutely. When I think about interim staffing and what we've talked about today, we've said how interim staffing is really used to help with those service gaps when there's, a surge in demand, when you're not able to potentially meet your demand with your current resources. So I would really recommend just looking at what your staffing best practices are. What we really do at Surgical Directions is making sure that we're looking at what the demand is and really staffing to demand at our organizations. It's something that we have done for many, many years. And more recently, we have, developed software analytics and a tool which we call Merlin. And it's something that every time that we walk into an organization and any client consulting gig that we do, we're really looking at the data and the analytics and able to see hour by hour, day by day, what are the service needs that are happening within our organization and the organization that we're in, and how can we map that back to the resource needs. What is the nurse staffing that's required? What is the provider's staffing that's required? And this really allows you to be a bit more flexible with your staffing and not maybe staff, the same shifts on a Monday as on a Friday when you're, half as busy. This allows you to, really increase employee satisfaction. You're not having your staff come into work a full day on a Friday when they're, not really doing anything and just twiddling their thumbs. It also helps when, say, every Tuesday or, unpredictably on a Tuesday, you have your staff that are consistently working past their shift and missing picking up their kids from school. So, it's really helpful to not only, again, with employee satisfaction, but also with your bottom line. So I would really recommend, again, we'd be happy to, help with this analytically and use data and insights, but even just for the organization to make sure that you're staffing to your demand, and then where needed, implement interim staffing where those surges in demand also need to be supported. And I think that'll really help make a difference.
Well, great. You offered some really great, cohesive, great examples of what this looks like. Do you have any final thoughts before we end our conversation today?
Final thoughts, I really think that we're all in this together. There is about 80 to 90% of organizations that have been put in an interim in the last 12 months. And we've definitely seen that as surgical directions through working with our clients in partnership with them as we kind of understand what their challenges are.
Mm-hmm.
And so, we've done interim services kind of secondary in the past 10 years. And over the last year, as we've recognized challenges, we've dedicated additional recruitment services, additional recruiters, and really ramped up creating a pool of candidates and operators to help support this. And so it's been really helpful for us to kind of reach out to candidates that are interested and support our clients in this. So I would welcome any conversations that anyone may have that are looking for leadership interim placements. We'd love to support anyone who is in need and kind of work through this time period together. We're always ebbing and flowing in healthcare. It's,
Right.
We all walked into this industry knowing that we're going to have to problem solve every day. But we're here to help, and we'd love to talk to anyone who would like to have a conversation.
That's great. So thank you so much, Audrey, for your time today. I really enjoyed it.
Absolutely. Thank you, Maria.
All right, and to our audience, thanks for tuning in today. Look for more one-on-one episodes in the coming months by visiting our website and our social media platforms. Thanks so much, everyone.